Are you considering getting liposuction done, but you're very confused? There's so much stuff online. It can do this, it can do that. You don't know what it can and can't do. To solve these questions, I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Centre for Aesthetic Health, Bangalore. And today, we are going to talk about what liposuction can and can't do. So firstly, let us talk about what is liposuction. Before we talk about what it can and can't do. Liposuction is a body shaping surgery. In our body, we have the skin. Just below that, we have a layer of fat. Below that, we have a layer of muscles. Below that, we have our internal organs. In this surgery, we're making tiny holes in the skin and we're removing a fat that is just below the skin. Liposuction. Lipo means fat. Suction means removing. That is where the name comes from. So now what it can and can't do. Number one, what liposuction can do is it can remove stubborn fat. Everyone has areas of stubborn fat. What does stubborn fat means? It means it is that fat which has very few receptors to fat burning hormones. It has a lot of receptors to fat storing hormones. So this is the fat that is kind of very hard to get rid of. It is the last fat in your body to go. Everyone has this. When you start exercising, there are some areas where the fat goes away very quickly and there are some areas where the fat takes longer to go away. This stubborn fat, it can go, but it will be the last fat in your body to completely go away. So what liposuction can't do, it cannot get rid of all the fat in your body. It is aimed for those pockets of stubborn fat such as the love handles or the tummy. We don't do liposuction as one complete fat removal surgery wherein we remove every single fat in all parts of the body. Also, some fat is important. Our aim isn't to remove every single fat cell. Our aim is to remove that extra fat that is bulging and not looking very nice. Secondly, what liposuction can do? It can start your weight loss journey. What it can't do? It cannot do weight loss by itself. The aim of this surgery is not to lose 10-15 kilos. That is not going to happen. The aim is to lose those extra bulges so that you move better, you feel better, the volume goes down, your clothes fit better. When this happens, you will feel more mobile and that can kickstart your weight loss journey, so which you can improve the result of liposuction with your efforts through diet and exercise. So, for a lot of people, this is a starting off point to begin their weight loss journey. The surgery in itself is not going to cause weight loss. That's a different category of surgery called bariatric surgery. Number three, what liposuction can do is improve specific areas or conditions such as gynecomastia. People with gynecomastia, that can be treated. People with a double chin, that can be treated. People with loose arms, with flabby arms, that can be treated. People with fat on the inner thigh that is rubbing together, that can be treated. People with saddlebags, bulges on the outside of their thigh, that can be treated. What it can't do is it cannot tighten very loose skin or it cannot get rid of stretch marks. Remember, this surgery is working on the fat layer, not the skin layer. So particularly in people who had multiple pregnancies, they have a lot of loose skin in their tummy. Liposuction is not going to get rid of that loose skin. That's a separate category of procedures which are skin removal surgeries, such as a tummy tuck, such as an arm lift. Number four, what liposuction can do is boost your confidence. You look better in the mirror, your clothes fit better, you feel better about yourself. That's the whole point of this surgery. What it can't do is to completely get rid of your diet and lifestyle and your exercise. Whatever result you get with the liposuction, you have to maintain it and build on it with your efforts. Otherwise, that fat can come back. So with all this, we can now understand who is an ideal candidate and who is a not ideal candidate for liposuction. An ideal candidate is someone who is otherwise quite fit, who has some pockets of stubborn fat, typically in the tummy or in the arms or in the inner thigh. They have tried everything and this is not going away. So they are motivated to get rid of this and then keep that result with their diet and exercise. It can also be good for people who are looking to start their weight loss journey and are committed to it. Who is not a great candidate for this are people who are morbidly obese. For them, liposuction won't make a very big difference. They might require bariatric surgery. The other candidate who are not ideal candidates are those who have a lot of loose skin. Particularly, there are women who have had multiple pregnancies, who have a lot of loose skin in their belly. They come for liposuction thinking that will get rid of all that loose skin, but liposuction won't do that. That might require a tummy tuck. And lastly, one thing which liposuction can do is to be very, very safe. Some people might be worried about liposuction, that it's an unsafe surgery. You might have read about people dying from this surgery, things like that. We do liposuction under local anesthetic. What that means is we only give anesthesia to the area that we are working on. We don't make you unconscious. We do it this way because number one, it makes the surgery very, very safe. You're avoiding all the risks of general anesthesia. You're also avoiding the really bad complications of liposuction, such as internal perforation, things like that. All those complications are greatly reduced under local anesthetic. Number two, we can make the patient stand up in the middle of the surgery. See how it is looking, make him lie down, do some more. This helps us to give a better result. Number three, because the patient can stand up, we do our dressings in a standing up position. We're able to squeeze all that fluid out. So our incidence of post-op complications such as seromas is also extremely, extremely low. If you want more information about local anesthesia liposuction, you can watch our other videos. Let us now look at some photos or examples of patients who have had liposuction in various areas. So I hope this video was helpful for you and it helped you understand what liposuction can and can't do, and it helped to clear some of the confusions you might have in this regard. Do like, share and subscribe. If you have any questions, let us know in the comments. Thank you. Have a great day.